Welcome. This is urinary catheter insertion and removal, male. As this is a demo video, you are responsible for everything that is in the skill stack. So let's go ahead and get into this. I'm going to come into my room. How's it going, Mr. Mayor? My name's Rory. I'm going to be your nurse today, and we have you scheduled for a Foley catheter insertion. Do you have any questions about this procedure at all?
I'm okay right now.
Okay, so I've already gone over and verified with the physician the reasons and the outcomes for this. So can you go ahead and tell me your full name?
John Mayer it is.
All right, and what's your birthday?
February 18, 1982.
Great, and how do you like to be addressed?
You can call me Mr. Wonderland.
Mr. Wonderland? All right, I will do that. So what I'm going to do right now is I'm going to use my clean gloves, part of my equipment, and I want to clean off my tabletop with chlorhexidine, just to ensure the sterility of this procedure. So I'll take my wipe. Just going to get it good and clean. And go ahead and discard. So, for this procedure, what I'm going to need are 2 sets of clean gloves, one of which I've already just discarded, so I've got one more. I'm going to need my Chucks pad, a bath blanket, and a sterile Foley catheter kit. And for that, we need a 16 to 18 French. Also, Mr. Wonderland, do you have any allergies, like anything to like iodine, latex, tape, lubrication, anything like that?
No, I'm okay.
Good, that makes my job easy. So, now that I've verified that my patient has no allergies, I have all the equipment that I need. What I can go ahead and do now, I'm going to put my gloves on. And Mr. Wonderland, I'm going to have to go ahead and expose you so that we can cleanse the perineal area.
Oh, okay.
Alright. And so to help kind of provide a little bit more privacy, we use this bath blanket. So then I can pull this up, like so. And provide Mr. Wonderland here a little bit added privacy for himself. Now that I've got him in this, I want to go ahead and separate his legs like so, and we'll make sure that he's still in a supine position. I'm going to take my Chucks pad. We're just going to scoot this right up underneath. So we have a little protective barrier against from the soap and water. So then I can go ahead and I'd wash that down with soap and water and pat dry and let it dry out as well. So from there I can now discard. Take my Foley kit, and I'm going to place this right on the bed. So now this is all about positioning, and we still have to maintain sterility, so we're going to do the no-touch technique when we open this. So first one I can do is just grab this tab, open it up like that, come around, and these new kits, you know, they can be a little tricky as they're all like to be really folded up. Just got to work with it a little bit. So from here I can go ahead and grab my sterile gloves. For me, I'm just going to bring it over here to the table just so I have a little bit extra room. gloves on, come back over to my sterile kit, and try and rearrange it just so I can get it to where it's not so hectic. So what I can do, maintain the sterility, go ahead and just flatten that out a little bit. Then what I'm going to do is I'll take my first drape, this one we're going to be placing underneath them. We need to ensure that we have the shiny side down, which is this side. So then what we can do is like so, as carefully as we can without touching any part of his body, maintain our sterility, come up underneath, and just slide this up. Like that. Okay, so now what I can do is I'll grab this, which is our fenestrated, and again, we want to make sure that our shiny side is down. Kind of just bring it up, down, like so. Okay, so now I can go ahead and arrange my kit in a manner to where it's easy and accessible. So I'll go ahead and just scoot this up a little bit. Great, so now I can again maintain or ensure that I have all the equipment that I need. So I've got my swab sticks, lubrication, and a 5 to 10C pre-filled syringe with sterile saline, and I have a 16 French catheter with an attached collection bag as well. So first thing I'm going to do is grab my catheter. Just want to remove this plastic covering. And just go ahead and discard. Now I can take my syringe and pre-attach it to the port. Now from here, just for ease, we want to just get this a little bit separated, and we're going to tear, like this is marked for here, but we're going to tear down a little bit lower, just so that it's easier for us to get to those sticks. Open it up a little bit, move them around. And then I can put those right there. Next, what we'll do is we'll grab our lubricant. Just go ahead and we'll put it all right here. And I can go ahead and discard. So now that I've done that, we're going to go on to cleansing the urethral meatus. And to do so, if they have foreskin, we need to be able to retract it back. And during the whole procedure, we have to maintain that we keep it back. Otherwise, if it comes up, then we've contaminated it, just like when we're performing for female insertion with the labias. Got to maintain that it stays back. So one of the tricks that they show you is you can come from the top of the penis and slowly retract back to where you're holding the foreskin and at the shaft of the penis as well, all in one. Now that I've got it hold right there, I can go ahead and grab my first swab stick, and starting from 12 o'clock to 12 o'clock, it's one swipe. Take my second swab, go back a little bit further, from 12 to 12, discard, and then the last one, 12 to 12. Now that I've done that, I can also get rid of this, just so it's not in my way. And I want to grab my catheter, and then we're going to generously lubricate. Alright, so Mr. Wonderland, we're now going to get ready to insert your Foley catheter. Are you ready?
Oh man, yeah, hope so.
Yeah, I hope so too. So as I do this, I just want you to bear down. Now as we insert for the male, we're going to raise the shaft towards the ceiling as to give us a direct shot. And then as I go, alright, Mr. Wonderland, here it comes.
Oh!
Yep. Now as I insert, if I had met resistance, which is usually common in older males, that's from like an enlarged prostate, you would stop, pull back a little bit, and gently again try and insert and get past. Now if you continue to meet resistance, you would then stop the procedure and notify the doctor. Now for this male insertion too, we're going to insert all the way up to this Y joint junction. And then when we get the urine return. So now I've gotten to that point, what I can do is release and grab. I'm then going to instill my 10 cc's of sterile saline. And then I can pull back just until we get that little meat right there. Pinch off, disconnect my 10 cc syringe. And then what we want to do is so that we give him, we're going to tape it just about right here, just so that we can allow him a little bit more movement and it's not creating tension on this catheter. And so as I've done that, I need to take the bag, hang it on the bed frame so as to prevent retrograde or urine backflow, and maintain that there are no kinks in the tubing as well. And from this point we can go on and document what we've done, how many cc's we've instilled, and all the other standard documentation that is required. And so that is our Foley catheter insertion. So from there, let's go ahead and get into the removal part of it. And so from removal, the equipment that you're going to need is a pair of clean gloves, an alcohol swab, and an empty 10 cc syringe. So to come in, you still have to do your standard greeting of prep, verify the physician's orders for purposes and outcomes. Hi, Mr. Wonderland. How are you doing today?
I'm doing fine.
Oh, that's great. So I have good news. We're taking out that catheter today.
Yippee!
I know. It's great, huh? So it's going to be a little uncomfortable as we do this, but I'll try and be as gentle as possible. So the first thing we want to do is we're going to release the tape. Then I'm going to take my alcohol prep pad so that I can swab this port for 15 to 20 seconds, rubbing vigorously. From there I can take my sterile, empty 10 cc syringe, and then I'm going to note for about 10 cc's back, because it was previously documented as that as being tongue-tied, as that being how much was instilled upon insertion. So we need to make sure I get the full 10 cc's back, which I have. So now what I'm going to do, Mr. Wonderland, I'm going to come out. So here we go. Ready? 1, 2, 3.
Ooh!
And we're done. And from there we can loop up and over and discard. And then as well, for post documentation, we need to note the time and amount of which the next void occurs. And from there, that is the male insertion and removal. Thanks.